on improving benefit access and utilization for children and their families who are experiencing poverty. This event is hosted by the U.S. Department of Health and Human Services with our partners in the Department of Labor and the Social Security Administration. So before we just jump in, just a few event logistics. If you are experiencing any technical issues, please just let us know in the chat and someone from the tech team will try to help out. While the chat today is limited to conversations with the host and the panelists, we really do encourage you to post any questions you may have in that Q&A box, which is going to be at the bottom of the screen. And we also have American Sign Language interpreters and closed captioning available. And the event recording and materials are going to be posted on the youth.gov website. And we can go to the next slide. So I am Jennifer Brzezinski. I'm the Associate Deputy Assistant Secretary for Human Services Policy within the U.S. Department of Health and Human Services in the Office of the Assistant Secretary for Planning and Evaluation. And for those who may not be familiar with the Children's Interagency Coordinating Council, in December of 2022, Congress provided funding to create the council, and HHS was charged with standing it up. You can go to the next slide. So Congress charged the CICC to foster greater coordination and transparency on child poverty across federal agencies, to examine and report on a really broad array of cross-cutting issues affecting child well-being, and to engage the national academies to do a report analyzing federal policies that affect child poverty. The council is currently made up of 10 federal departments. It represents over 140 federal benefits and programs that serve children and families. The council is the only interagency group that focuses on all children, and we go up to age 18, and focus on the coordination of federal child policy with a particular interest in well-being in poverty. Now, children, of course, live in families and communities, and we really recognize the important role that parents and caregivers have in promoting child well-being and reducing child poverty. For those reasons, as a council, we examine well-being issues and child poverty from a multi-generational perspective. Next slide, please. So the council convened for the first time in January 2024, and we had been working to identify priorities and goals for the inaugural year. There's been a lot of interest and a lot to do in the areas of child poverty and well-being. So we really wanted to focus our first year on listening and learning from each other as members, federal agencies, learning from other relevant federal interagency groups with similar goals, and learning from experts, including those with lived experience. We have brought on 20 lived expert consultants to inform and strengthen our work, and already those experts have been integrated across the council's work, including shaping and presenting today's event. As we learn, we want to promote transparency on relevant child poverty and well-being issues, as Congress requested. We are doing that through our public engagement efforts, including issuing a quarterly newsletter, hosting knowledge exchanges such as this, and soon we will be standing up a dedicated webpage for the council. Now, this year, we're focusing our coordination and collaboration efforts on childcare. Childcare is, of course, an important support for economic mobility for children and their families. About 2/3 of children in poverty have a working parent, and most or all will need or are already using childcare. Also, I want to note, particularly from an HHS perspective, it's important to say that the quality of childcare not only helps families improve their economic mobility, but improves well-being and outcomes for kids as well. And in the fall, we plan to share our learnings and highlight relevant federal resources and supports on childcare in our next knowledge exchange. Next slide. So if you are not already connected to us, we really encourage you to subscribe to our quarterly newsletter. You can also learn more about the council by reviewing our report to Congress or watching the kickoff event we had last November. All right. So why did the council decide to focus on benefit access and utilization? In a recent federal report titled Tackling the Time Tax, estimates were that every year more than $140 billion in government benefits that Congress has authorized goes unclaimed. This includes tax credits for working families, nutrition assistance, health insurance coverage for low-income adults and kids, unemployment benefits, and disability supports. So we really want to take the time today to learn directly from lived experts, researchers, and community leaders to figure out kind of why these benefits might go unclaimed despite the documented need. So we're going to have three kind of separate but interrelated panels on benefit access and utilization issues and challenges, including stigma, administrative burden, and benefits cliffs. So just for example, to mitigate loss of Medicaid coverage after the COVID-19 pandemic, HHS provided waivers to states to allow them to use information they already have, like receipt of SNAP, to determine financial eligibility for Medicaid coverage without making people just do the paperwork another time. This so-called ex parte process is just one example of more we'll hear of federal agencies trying to minimize burden to avoid a break in coverage due to administrative reasons. And we've included some resources on administrative burden and benefit cliffs at the end of the presentation for your reference. So our first topic, stigma, is not new, particularly in the disability, behavioral health, and justice work. I think there's been a little bit less discussion about the real and perceived barriers related to poverty stigma and the opportunities to address these issues. So I'm very excited to introduce our first panel, which will focus on this issue. It's moderated by one of the council members, Kirk Liu, the Director of Youth Initiatives for the Department of Labor's Office of Disability and Employment. Just want to express my appreciation for Director Liu's partnership and passion for this work and hand it off to you. Thanks.
Thank you so much, Jennifer. And as Jennifer mentioned, my name is Kirk Liu, and I'm the Director of Youth Initiatives for the Office of Disability and Employment Policies, which sits in the Department of Labor. I have the pleasure of moderating this panel on poverty stigma, and I would like to introduce our incredible group of subject matter experts. First, we have Dr. Elizabeth Lanos from the Harvard Kennedy School of Government. She'll be talking about her research on how stigma affects families' participation in the social safety net programs. Second, we have Jillian Rain Bird, who's our CICC living expert consultant. She'll talk about her own experiences with poverty stigma, particularly from a multi-generational and intersectional lens. And last but not least, we have Alexis Bylander, who's coming to us from the Food Research and Action Center. She'll talk about how states are implementing universal policies, such as the Healthy School Meals for All, to promote healthy well-being, reduce stigma, and advance equity. Next slide, please. So some of you may be aware of the phrase, nothing about us without us. This was a phrase that was adopted during the disability rights movements in the 1990s, trying to promote better inclusion of those affected by policy and program decisions. Involving the people who are directly impacted by poverty is crucial. It's important to have those voices in helping us shape policy programs and narratives related to poverty. Without that input, we may unintentionally harm or continue to create stigmatizing policies, practices, and research. At the Department of Labor, we understand the importance of fear in disclosing and understanding how stigma can impact employment for people with disabilities. We understand how important that is to approach it holistically. We need to support the job seeker. We have created tools like the 401 disclosure, which is a workbook that helps adults and professionals supporting young people to really think about informed decisions around disclosing their disability. But we also understand that we have to create tools for employers. So tools like the Job Accommodation Network, or JAN, is a great tool that's free, expert, and confidential guidance for workplace accommodations and disability employment issues. But before we jump into topics of administrative burden or benefits cliffs, we really need to consider how specific narratives and practices affect how children and their families perceive and participate in programs and services. So let's transition to our panel discussion. Back to the previous slide. We will start with defining stigma, exploring how it impacts children, families, and communities. Then we will highlight policies and interventions that can reduce poverty stigma. So let's define stigma. And the first question is for Jillian. Jillian, from your own lived experience, how do you define stigma?
Yes, hello everyone. So how I define stigma, or the concept of stigma, really leads to stereotypes and biases. The stigmatization of growing up on an Indian reservation in poverty led me to feel invisible and almost forgotten by society. And the internalization of negative stereotypes led to feelings of inadequacy, guilt, and self-blame. So to define stigma, it is a combination of the shame and embarrassment experienced while in poverty, with the fear of judgment and being portrayed as lazy, unworthy, and even responsible for my own situation. I also think it's important to note that we need to view stigma from other perspectives. We need to acknowledge the historical and cultural contexts that shape experiences as well, such as colonization and slavery. And if you live in a high poverty area, you really already feel as though you're failing in life. So having to ask for help just highlights the feeling of shame and embarrassment. That really kind of just sums up stigma for me.
Thank you, Jillian. Same question, Elizabeth, but based on your research, how is stigma defined in your literature?
Thank you, and thank you for the invitation. In the academic literature, what we're finding is very similar to what we heard from Jillian. So, taking tools from the mental health literature and from evidence from public health, in our work that includes nationally representative surveys across the U.S., we're really seeing stigma in three big buckets. So the first bucket we're calling societal stigma. So these are the stereotypes that Jillian mentioned that are gendered and racialized and can span from stereotypes about unworthiness or not being deserving or laziness, and are really pervasive across society across the US. And then there's these two other forms of stigma that are related or come out of that societal stigma. The first is internalized stigma. So that's the feeling of shame, a feeling of inferiority, a feeling like it's your fault. And we see that that really does affect people's behavior. It often makes people withdraw from the system as a whole. They don't want to ask for programs for which they're eligible because of that internalized shame. And then there's also anticipated stigma. Even if you yourself don't feel ashamed or you don't feel guilt, you might recognize that you will be judged by others, both in your community and also in the people that you would have to interact with to access programs and services for which you're eligible. And that anticipated stigma also brings people away from the social safety net in ways that create the gaps that we've already been talking about between the people who are eligible for programs and the people who are able to access them.
Thank you so much. So now let's think about how poverty stigma impacts families and communities. Jillian, let's go back to you on how does stigma show up for families and children within applying for benefits?
So stigma manifests in different ways. Imagine the daily struggle of choosing between paying for groceries or rent. Imagine having to neglect your health just in order to eat. It makes it very difficult to request benefits or services when you're treated with suspicion or excessive scrutiny. Look, I mean, the application process can be so difficult, and gathering documentation can be a daunting task. For me, When I look back, stigma manifested at an early age. I remember as a young child going up to the cafeteria line for seconds because there were only times when I ate at school, only to be treated harshly by the cafeteria workers. That whole experience really just set the tone for me for adulthood. You know, I'm the mother of a little Black girl in a wheelchair. So I was extremely reluctant just to seek help and services for her. I remember already feeling overwhelmed with the emotional pain of having to raise a child with complex medical needs, and having to deal with implicit bias from administrators made me feel inferior. In several interactions, my family experienced judgmental treatment, and there was less empathy to our situation of being a family with a disabled child. I remember really working hard to make sure my daughter's hair was just right and her clothes looked decent just to be perceived differently. Our family's experience really highlighted the injustice of being judged and shamed simply just for needing assistance. I also want to add that stigma manifests in inaccurate portrayals and disrespectful representations of BIPOC communities. We should highlight more achievements and success of BIPOC individuals. But that's really how I see stigma manifest for us.
Wow, Jillian, thank you for your perspective. Alexis, we're going to go to you and want to know, how does stigma show up for children experiencing food insecurity?
Yeah, thanks for the question. So I work for a national nonprofit organization that advocates on behalf of all the federal nutrition programs, and I work specifically on school breakfast and school lunch. And the school meals programs are so critical for reducing childhood food insecurity. There are many children across the country who rely on school meals for the majority of their food, and some of the healthiest food that they eat. So when I talk about these programs, usually I'm talking about the need to protect and strengthen them, but I also, as part of my job, talk about the need to address the stigma and shaming that happens in these programs as well. For the majority of states, children who eat school meals are divided into 3 eligibility categories: free meals, reduced priced meals, and paid meals. And students are typically very aware of what category they fall into, and it influences their behavior and experience in the cafeteria. There are a lot of fears by some students that they don't want to be perceived as being from a low-income household, and will choose to not participate in the meals, even though they need them, because they don't want to be perceived as low income. And that is incredibly problematic, because we need all kids at school not well nourished and ready to get the most out of their school day. Another thing that happens with school meals is the shaming that can occur on children and families for accruing school meal debt, which happens when they can't or aren't able to pay off meal debt that has accrued. Many of you have likely seen reports in the news of kids having their meals taken away from them in line and thrown in the garbage, served an alternate meal, had their hands stamped to show that they are accruing debt, or be denied things at school like graduation tickets or the ability to cross the stage at graduation. And so these are just some of the ways that stigma and shaming occurs in school meals. And I'm excited to talk in a minute about how best to address that.
Thank you, Alexis. And thank you. We're going to go right back to you, because we want to really think about the types of policies and interventions that can reduce that poverty stigma. So, Alexis, can you tell us more about how states are addressing the issues of stigma in school meals?
Yes, so 8 states to date have passed policies that we call Healthy School Meals for All policies, that cover the difference in the federal reimbursements that they receive for school meals and the total cost of offering a free breakfast and a free lunch to all students. And so access to free meals is just baked in as a part of the traditional school day, like other things that students need for success, like access to teachers, textbooks, and technology. And also, many people may remember that for a little over 2 school years during the height of the pandemic, waivers from USDA allowed all schools the option of serving free school meals to all households, regardless of household income. And that was an incredible success. And there were a lot of parents, teachers, administrators, school nutrition professionals, and others that realized they never wanted to go back to the system of three tiered categories for eligibility. And so, like I said, 8 states have passed healthy school meals for all policies, and over 20 states have introduced legislation, similar legislation. And so I really see this as the future for school nutrition and for schools. And I'm really excited about the momentum around offering healthy food to all students as just part of the education that they receive.
Thank you, Alexis. So same question, Liz, but can you tell us more about the research done on destigmatizing rental assistance?
Sure. And one thing I want to highlight from what Alexis is saying is that the pandemic really gave us an opportunity as a broader policy community to try things that had never been tried before, both in reducing administrative burden and rethinking programs. And in rental assistance, we saw the same thing. So at the beginning of the pandemic, as many of you know, there were dollars flooding to local governments to help families stay in their homes and avoid being evicted as part of rental assistance programs. And so what we did with leaders in Denver and Austin, Texas, is said, okay, how do we think about messaging out the existence of rental assistance programs for families who may have never needed these programs before, may have never accessed rental assistance, and may be struggling with the stigma associated with housing and housing assistance. And what we find is, we're not going to solve the housing crisis with changing messaging, but the language that is used to describe the programs really does make a difference in who ends up applying and engaging with city services. So we found that just changing the language and kind of proactive outreach that the cities were doing to take out or target some of that stigmatizing language made a difference. So kind of 30% increase in engagement in Austin, almost 20% increase in asking for applications for rental assistance in Denver. And the differences are really very light. Rather than saying a lot of people need help right now, saying if you need help right now, it's not your fault. Like those small changes really do make a difference. Rather than saying call this number and someone's going to tell you if you're eligible, flipping the kind of agency to say call this number and we'll help you decide if you're eligible really brings back kind of the dignity and the power to families. And those slight changes to language really do make a difference in the number of people who apply, the number of people who engage with these programs, as well as the demographic characteristics of the households that participate. We saw a 6-fold increase in Black and Brown households applying for programs and part of the Denver programs. And so to me, that opens up the door for more research and more testing and more piloting of ways that all of our programs can remove destigmatizing language in government outreach as one of many potential solutions that we need to address in this broader space.
Thank you, Liz. And last but not least, Jillian, from your perspective, how can systems do a better job of destigmatizing poverty?
Yes, so we know there are several community interventions happening with community-led initiatives. Grassroots organizations and community centers are hidden gems in BIPOC communities. These organizations do a great job of advocating for those experiencing high levels of poverty. The organizations really empower their communities by involving the community in the design and the implementation of policies and programs that affect them. That is all that is very crucial when pushing for change in BIPOC communities. I do know that most of the smaller organizations are underfunded and they need help to highlight the work that they are doing. Really, we need to do better in involving community members in the policymaking process to ensure that their needs and perspectives are addressed. So really just circling back to the principle of nothing about us without us.
Thank you, Jillian. And with that is the end of our panel discussion, and we'll transition to some question and answers. Are there any questions that we've received in the chat? No, we don't have any. No questions at this time, but I do have a question that I would like to pose to our panelists. That question is, what are some key principles to redesigning policies, programs, or research that is aimed at reducing poverty stigma? We kind of touched on some of this, but if we can dive a little deeper, and Alexis, we'll start with you. What are some of those key principles?
Well, I think when it comes to school meals, I think some key principles are that all students really need access to healthy food to really get the most out of their school day, whether that food comes from home or or from the school. We as the country invest way too much in educational investments for children to not be able to get the full benefit of those investments because they are so hungry that they cannot focus or pay attention. And I also think another principle is not means testing parts of the school day that are critical for kids to be successful. And we don't do that with Chromebooks or textbooks or library books or reading assistants, and school meals needs to be a part of that too. So thanks for the opportunity to talk about this topic that I'm really passionate about.
Thank you, Alexis, for your expertise. Same question, Jillian. What are some of those key principles for you?
So just a few key principles. One of them is we really need to think about the time tax, because time tax has a serious consequence when it comes to those in poverty or with medical conditions. You can lose housing, you can become homeless, families are literally skipping meals, they're forgoing medication. And in my instance, my daughter died waiting on a Medicaid waiver. And so there are serious consequences to the time tax. I also want to reiterate building programs with those that the programs are intended to serve.
Thank you, Jillian. And Liz, same question for you. What are some of your key principles from a research perspective?
Yeah, I mean, both Jillian and Alexis said the key principles that I would highlight as well. One thing just to echo is that oftentimes what appears to be either a time tax or an administrative burden or just paperwork is actually rooted in stigma or stereotypes against people who are low income. So one thing that I would encourage all of us to do is think about, when we add work requirements, when we add, recertification every 6 months, what is it about specifically the social safety net and means tested programs that requires all these additional hurdles? And are those really rooted in incorrect stereotypes about the poor in the US? And just to give you kind of a counter example that I use in some of my classes at the Kennedy School, when we talk about businesses, there's a global index called the Ease of Doing Business Index. And the entire purpose of that ranking system is to rank countries against each other about which ones make it as easy as possible to do business in your country. And it's considered obviously true that we need to make it as easy as possible for a business to start, to close, to pay their taxes. And so I wonder, why is it that for low-income families, we don't have those same principles in the design of our programs? In our research, we showed that a lot of that comes from stigma. And so the stigma isn't only affecting the families themselves directly, but indirectly in policy design choices as well.
And with that, thank you to our panelists for your expertise and sharing with our participants, Dr. Elizabeth Lanos, Jillian Raining-Bird, and Alexis Bylander. We appreciate your time with us today. Some of the key takeaways that we can really take from this discussion that I think is important is to really understand, the importance of stereotypes, the biases, culturally and the historical context. We need to be culturally responsive to the people that we're working with, the people that we're serving. As we mentioned, we have to include people in those discussions. And it's just as important to include our partners. We need to make sure that the right people are at the table so that we have the right discussions so that we can really solve those issues. There's an impact here, fear, shame, lack of trust, We got to make sure that the information is available so that people can make informed decisions. And we got to make sure that access to these services are there. We need to really think about how we're framing some of these discussions, make sure that we're thinking about some of those programs and services that are really working, and think about ways that we can emulate and replicate some of those things that are working with these different populations. Again, thank you to our presenters for their perspectives and sharing with us, and also think about opportunities for us to be innovative. I also heard a lot about innovation and coming up with ways for us to be innovative. Next slide, please. So with that, I'd like to pass it over to our panel focused on administrative burden. That's being moderated by Kathleen Romig. She's the Executive Advisor on Children for the Social Security Administration, Office of the Commissioner. Take it away, Kathleen.
Thank you so much, Kirk. I really appreciate it. I'm excited to be here. And we have an exciting panel here from all over the country. I'm coming to you from Washington, D.C., where, as Kirk said, I'm advising Commissioner Martin O'Malley on all things children. And on our panel also is Rachel Hatton Moore, coming from South Carolina, Dr. Derek Wu from Virginia, and Monica Ferre from California. So with that, I'm going to frame it up a little bit and pass it on to them. So this panel is about administrative burden, or in more sort of plain language, as Jennifer mentioned at the top, the time tax. What kind of burdens and times are associated with learning about, applying for, and accessing public services and benefits? So that's what we're going to talk about today. The costs associated with administrative burdens include not just time, but effort, money, expertise, everything that a family might need to navigate a complex system and to get the benefits that they deserve. And not only that, but the administrative burdens have a psychological toll on people. Managing the stress and anxiety, the uncertainty. On top of all the stress, of course, we're talking about children with parenting, the stigmas that we talked about in the last panel, and perhaps having limited resources and support as families are trying to navigate these systems. So I am very interested in this topic myself because, again, as Jennifer was talking about at the top, the federal government really has a renewed focus right now on unclaimed benefits. And my job at the Social Security Administration is ensuring the children who are eligible for our benefits get them. And in order to tackle that problem, my first job is to identify those kids and reach out to them. And then my second job is to ensure that once they come to us, that their families don't face undue burdens and that they are able to access the benefits for which they're eligible. So I'm really excited for this panel. Rachel is going to talk a bit more about the first part of what I just said, identifying and reaching out to families who are eligible. And in fact, Rachel and I have been working together on exactly that, on finding young children who are eligible for Social Security and SSI benefits. She's also done a lot of work on working with families to identify those administrative burdens and reduce them. Next, we're going to hear from Dr. Derek Wu. Derek is going to talk about his research on administrative burdens. And then finally, Monica Ferre is going to tell us about her lived experience navigating these systems from start to finish and really bringing everything together. So each of our panelists is going to speak for about 5 minutes, and then we will take questions. So please put those into the Q&A field in Zoom. And with that, I'm going to pass it off to Rachel. Thank you, Rachel.
Thank you so much. I'm Rachel Hatton Moore. I'm the Two Generation Systems Manager at the South Carolina Early Childhood Advisory Council. And in this role, I am the project manager for First Five South Carolina and also the facilitator and staff support for the South Carolina Family Voice Council. And in the development of First Five, we started with the Preschool Development Grant Statewide Parent Needs Assessment in 2019, where we listened to thousands of families from across our state. And what we heard from them is that it was difficult to navigate the early childhood system. It was hard to find out about public benefits and even harder to apply for them. And so some of the things we heard from the Family Voice Council then was that it takes forever to wait in person, finding support, knowing what you're eligible for, and then sometimes going and sitting in offices only to later find out you weren't eligible to begin with. And so we took all of what we learned, and the Early Childhood Advisory Council adopted First Five South Carolina as a state level project. Next slide, please. And we worked so that families could get what they wanted, needed, and deserved, and listen to them in the development. So throughout development of First Five, we had community listening sessions with different stakeholder groups, parent test sessions to make sure that it operated, it was clear, it was easy to understand, it was in plain language that was family first and positively framed. And then also that they were able to navigate the site easily. And so we adopted this, of course, as a joint project because we wanted all families to be successful. And we felt that we had a duty as a state government to be able to reach these families and let them know about what was available to them and to help them be able to have services wrap around them in their earliest times of need and support. And so in each phase of development, we did this listening and really made sure that the symbol screener took only a few moments to complete. And so we asked simple things about their household income, their household circumstances, and we worked together with all the participating agencies, about 11 of them, to make sure that all of these clearly outlined their criteria so families could find out what they were eligible for. And then we began development and started a common application where families could easily pull together and save in one space the documents required for the different applications, have information from one to the other auto-populate to make this a quicker, easier process and easily submit. And what we've learned is that about 60% of our site visitors come to First Five after normal business hours when state offices aren't open. Next slide, please. And so one of the things that we really had a lot of dedication to is making sure that families were able to find information about First Five. Just because you build something doesn't mean people will come, right? And so we spent just as much time, effort, and resources in making sure we were able to reach families as a joint effort among our agencies. And so we did things like targeted laundromats in low-income zip codes and grocery stores. And we heard from our Family Voice Council is that these were places that they sought information and were in their community to find information. We also did advertisements and outreach with bus stops and radio, as well as social media to reach families. And we also did direct service provider trainings and worked with pediatricians and medical providers to make sure there was information in their offices. One of the other things that we worked to pilot was a newborn supply kit to help find parents of infants so that they could learn about early childhood services that they might not have otherwise heard about. Next slide, please. And so in listening to families, we know that First Five works for them. We've heard it from them directly through their stories and from their own voices. And then we also have what the data is telling us. So since the launch of First Five, we've had over 300,000 unique visitors, almost 400,000 different families complete the eligibility screener, almost 80% of those being eligible for at least one program or service. And as of June of this year, just 13 months since it launched, we've had almost 3,000 applications for services submitted. Next slide. And so feel free to go and look at First Five for yourself. And if you are in a state that's interested in learning more about the process, you can visit First Five for All or reach out to me here for more information. Thank you.
All right, and next up we have Dr. Derek Wu.
Great, thanks very much. Great, well, so I'll talk a little bit about administrative burdens that are associated with an increasingly prominent trend in the United States, which is a move from in-person interactions with caseworkers to more virtual automated interactions. And so in recent years, lots of programs in the US have moved towards allowing people not only to apply, but also to recertify for benefits virtually. And so this figure here shows just for a single program, which is SNAP, the growth over a 20-year period in the number of states enabling some sort of virtual access, be it setting up applications online, enabling clients to apply via call centers, or allowing clients to conduct interviews over the phone as opposed to in person. So as you'll see, in the early 2000s, fewer than 10 states had some sort of virtual access in place, but by 2015, every state had that enabled of some sort. And so these changes are often thought to be beneficial for good reason. They can provide more convenience for applicants to apply from the comforts of their own home, outside of business hours. They may reduce stigma, which is relevant to the themes in the prior panel. And they may also lower administrative costs for state and local offices. And since the COVID pandemic, these changes have, out of necessity, accelerated. As everything in person shut down and folks quarantine in their homes, the work still went on in terms of getting people benefits virtually. And as we're leaving the pandemic behind, a lot of states and localities are continuing to rely on a number of these automated features in their systems. Next slide, please. That being said, these changes are not without downsides. And in particular, the lack of in-person caseworker assistance can also lead to greater inflexibility, as well as an inability to tailor services to individual circumstances.
I apologize, everyone. Is Derek frozen for everyone?
Meetings with caseworkers. Next slide, please. So I thought I'd talk a little bit about the research that I've done on this topic, focusing on how many people are prevented from enrolling, and also what types of clients are screened out by the automation of caseworker assistance. And so I have a paper from 2023 titled Certification and Recertification, What Happens When Automation Goes Wrong, which is co-authored with Bruce Meyer. And the setting of this paper is that in 2007, the IBM Corporation took over the management of 3 key programs, so SNAP, TANF, and Medicaid, in a particular state. And so this occurred far before the pandemic, right around the onset, actually, of the Great Recession. And so what IBM did was that it used online and phone interactions all under the umbrella of virtual casework assistance to replace face-to-face interactions with caseworkers. And this resulted in a number of administrative burdens stemming from the lack of personalized assistance, a lower tolerance for errors on the part of computers and call center workers, and also long wait times at call centers. And the reason we're able to study this is that the automated system was only rolled out to 2/3 of all counties in the state before it was halted. And so we have a group of counties that ended up being automated, which you can think of as a treatment group, and then another group of counties that never got automated, which you can think of as a control group. And so we were able to compare these counties to each other before and after IBM came in as sort of a natural experiment. And what we find are quite pronounced declines in enrollment across all three programs as a result of these changes. And so 1 year after automation, we find that TANF enrollment falls by 24%, SNAP enrollment falls by 15%, and then Medicaid enrollment falls by 4%. And these declines are due both to people not being able to get on programs for the first time, and also due to folks being forced to exit as a result of these burdens. And we find that the different effects across programs are primarily due to differences in the difficulty of recertification. So Medicaid, for example, which has the smallest decline, tends to have the longest recertification intervals at around 12 months. But then TANF has much shorter intervals for recertification. And so that requires more frequent interactions with the system and thus more opportunities to get kicked off. And finally, we're able to look at who are the clients who are not able to enroll. And here we find something quite sobering at the recertification stage, namely those who are forced to exit tend to be among the neediest recipients. They have the lowest incomes, they have the highest benefit amounts. And a key implication here is that in-person interactions with caseworkers may be especially important at the recertification stage. And so it's important to think about how to design systems to emphasize that in-person contact where it really matters. And I think more broadly, we often focus on ensuring that clients face minimal barriers in getting on a program for the first time, and that's super important. But just as important, if not, is ensuring that clients who are actually eligible can actually stay on these programs after they've initially gotten on. So with that, let me pause and thank you.
Wonderful, thank you, Derek. And we will pass the torch now to Monica Ferre, and then we'll open it up for questions. And I see some great questions in the chat. Thank you so much. Keep those coming. And yes, Monica.
Hello, everyone. I am a first-generation American, born and raised here in San Francisco, California. I became a teen mom at 17 years old. I was unhoused and left to learn how to navigate parenthood without a stable environment. I struggled without benefits for my child until I was 18 years old. Obtaining my documents, as simple as my child's birth certificate, was a major challenge due to my missing of pertinent documents such as my own birth certificate and state ID card. I found without a home, proof of residency was impossible. I spent my first year as a parent learning how to nurture my baby and navigate a system full of administrative burden. At some point, I discovered local nonprofits that assisted me with securing the documents required to access Medi-Cal, housing, and food stamps. Eventually, I was able to collect cash aid. The relationships I built with social workers and case managers taught me the skills I needed to assist others who sought basic services, public benefits, and emotional support. These lessons led me into youth organizing, community advocacy movements, peer health leadership, and my present role at San Francisco Recreation Parks Department as a community development specialist for Requity. In my role, I witnessed a stronger shift from in-person system navigation to online applications. The impact of COVID-19 had caused a greater technology divide among communities and deeper desire for online automation processes and practices throughout agencies providing services and administering public benefits in our communities. At work, we saw the need to decrease the administrative burden on our customers, applying for financial assistance through the Parks Department. We found other ways to verify target populations who are unhoused, in foster services, and live in subsidized housing to reduce stress on families while improving our access to services. My journey has taught me the importance of centering peer navigation. The efforts in doing so, incorporating uplifting youth to lead opportunities that mitigate childhood poverty and adverse childhood experiences. I implore others to promote community members with lived experience to drive this work forward through educational development, career pathways, and expansions within economic mobility to make a better generation for futures to come. Thank you.
Thank you so much. I appreciate all of your contributions, and I'm really excited to get into some questions. We've got some already from the chat. So I'm going to start. One attendee asked, is there anything we can do at the federal level to reduce documentation burdens? For example, automatic eligibility, recertification, or self-declaration of certain things like income. So I don't know, any of the panelists is free to jump in on this one.
I can speak a little bit on it. I believe, especially with automatic eligibility, especially to the points where Derek was saying the recertification process will relieve a lot of burden on families, often that move and maybe documentation is misplaced. Also, being able to have the connections where these spaces are better equipped to help others get the documentations that they may need, and maybe allowing extension in time periods. Often the time burden that is maybe a 30 or a 90-day window isn't enough for a family to get the things that they need to meet the deadlines for these application processes.
Derek, do you have anything to add on this one?
Sure. I think, some of, I totally agree with what Monica was saying. And, some of these applications for these programs, just if you look at the list of documents that are required, it's 30 to 40 documents. It's, W-2 forms, it's, vehicle titles for vehicle assets. And these can be really burdensome for clients to provide, not only initially, but for them to update as their conditions change over time, even if they've already been on a program. And so I think to the extent that we can provide ways to minimize those burdens, whether it's through allowing other, state agencies or government agencies to provide those documents, rather than the client having the burden on them placing themselves to provide them, I think that could certainly minimize some of these challenges.
Thank you both. And from my perspective at the Social Security Administration, this is exactly the kind of question that we're looking into. What kind of changes would be required to make benefits more accessible? Sometimes it is in the law. And so, calling back our previous panel for universal access to school lunch, that does require legislative changes so that we change the law and allow universal eligibility for those children. But then there are other things that we can do, like Derek mentioned, on the documentation required. Maybe we can get those documents through data sharing agreements, for example. Maybe we don't need that level of information. I know on some of our SSA forms, we are asking sometimes to the details such as make and model of your car. Perhaps we don't need that level of detail that's not required by the statute, and we can just make a change and streamline some of those burdens. So I think that, it does take, I think, pretty rigorous look at what we're asking of people and what it would take to change those things. So I think it's a really good question, and I appreciate digging into that one. Next question. This one is specifically for you, Rachel. If we're first five in South Carolina, were you able to connect with families who had not previously engaged with government programs And if so, can you describe how you connected with them?
It's hard to know that for certain, right? Without talking to each family and looking at who's coming to First Five and their whole enrollment trajectory. We can make assumptions, however, based on the amount of households there are in South Carolina with children under age 5. So there's about 420,000 households in South Carolina with young children, and we have had almost 300,000 visitors since we started. Now, we know that not all of those are parents of young children, but we can assume that many of them are or are direct service providers helping families. And so, like I mentioned in my talk, we have taken a wide stance towards outreach. And so one of the things that we've done is, of course, work with direct service providers who are working with families to help make referrals. So some of them may have already been involved in other government programs, but not known about the full array of programs they're eligible for based on presumptive eligibility or other things available in their community. And so it's our hope that we're reaching more families than we would have without this. And I think our numbers certainly indicate that. Thank you.
Wonderful. Thank you, Rachel. And I'm just going to do one last question. And this one really strikes at one of the sort of tensions that we look at when we're considering access. That technology can be a blessing and a curse. You know, apps like or websites like what Rachel is working on can really spread the word about a program and make things a lot more accessible to people. But on the other hand, if we rely solely on technology, it can be difficult for people not to have some human interaction and assistance in navigating these systems. So this question, I think, sets that tension up very well. Our participant asked, you know, she mentioned that what has been really helpful is when there are public places like libraries where there are people who can help the public with the technology when it's out there. And she said it gets confusing. People can click wrong or don't know, or they're holding a baby and navigating a keyboard at the same time. And it's really difficult when the stakes are so high, as all of our panelists had mentioned. So she was asking, how do we ensure that we still have that human component in navigating these systems?
I'm happy just to quickly chime in here. I think, one thing that's I think, technology has a lot of benefits. And, I think we're seeing that with what Rachel's doing in South Carolina. I think one thing to keep in mind is technology is especially beneficial when it's in addition to in-person assistance and not to replace in-person assistance. Right? And I think it's, easier said than done, given that, there are costs associated with both technology and in person. And sometimes we think of certain systems as being more efficient than others. But I think it's when, folks have the ability to choose between the two options, go between them, maybe make errors in one, but they'd be able to switch to another system, ensuring that clients have the maximum flexibility to ensure that they get the benefits that they deserve. I think that's the most important thing, just to make.
And just from my perspective, I believe empowering and entrusting the communities who have this experience to be the frontline workers in these agencies, and reduce the need, create entry-level positions that don't require that higher education of a bachelor's or a master's to do some of these social work services, simply allowing them to be there to help folks get through their paperwork and find out their other needs, such as case management workers would do, so that the workers who are approving these applications can focus more on those caseloads.
Thank you so much. And yeah, with that, I'll just do a quick wrap up and pass on to the next panel. And then here we go, final slide. So yeah, just a couple key takeaways. We've really heard a lot about how these administrative burdens can screen families out of benefits that they're eligible for and they need. And that we really need both having some, high-tech solutions here, but also we always must have the human-based in-person interactions as well. That timeliness is so important. And that's not just at the beginning, but also when, people have to recertify for benefits as well. And that the document requirements can be really overwhelming and just having enough time. And so agencies need to take a closer look at what they're asking of people and helping them navigate that process. And we heard a lot of hopeful things about solutions, like what's happening in South Carolina, what Monica and her colleagues are doing in terms of peer support and community outreach. So using things like eligibility screening tools, incorporating family voices in everything that we do, people who have lived experience accessing these programs, and making sure we're really meeting people where they are and targeting our interventions where they're most needed and where they're most likely to be accessed. So with that, I'm going to hand it off to our third and final panel, moderated by Anna Fogel, who's the Senior Advisor to the Assistant Secretary of the Administration of Children and Families at the Department of Health and Human Services. Anna.
Thank you so much, Kathleen. Thank you for the introduction. I'm very excited to kick off this panel of experts on benefits cliffs. I'm going to briefly introduce the panelists so that we'll get to hear from them right away. So we'll first hear from Robin Gertner, who is at the Office of the Assistant Secretary for Planning and Evaluation, or ASPE at HHS. And Robin is going to talk about the definition and scope of the benefits cliffs and the impact of the marginal tax rate on families experiencing poverty. We'll then hear from Talithia Edwards, who's a lived expert consultant for the Children's Interagency Coordinating Council, or CICC. And Talithia will really center the conversation on the challenges that families experience in navigating the benefit system and cliffs. And then last, we'll hear from Christina Morales, who's with Connecticut's Office of Early Childhood, and from Sarah Griffin, who's a National 2Gen consultant, who will talk about their benefits cliff tool and how they partnered with families to roll out this resource. So let's jump in. I'm just going to do a little bit of framing before I pass it off to the panelists. So at the Administration of Children and Families, our goal is really to support and uplift families to help families reach their full potential. And benefits cliffs really force families to choose between economic mobility and independence and losing access to critical supports. So this is an issue that we are really committed to focusing on and working closely with our state, federal, and local partners to really solve. Earlier this year, we hosted a convening with 17 states and DC, where we heard from parents with lived experience, organizations, and leaders from other federal agencies to discuss ways to minimize the benefits cliff. And then in April, just a few months ago, we hosted a national webinar where more than 400 people registered, which just shows the momentum and urgency that exists to focus on this issue and really look for solutions. This is something we're hearing from state leaders, from parent leaders, from business leaders all over the country, because this really is an issue that has an impact on all of these areas. So we know that no single state, federal agency, or business can really untangle this challenge. And it's an issue that requires dedicated, ongoing collaboration and partnership. And I'm excited to hear from everyone on this panel about the work that they're doing and their experience with benefits cliffs, so that we can all think more about our role and solutions. So Robin, I'm going to turn it over to you to kick us off and ensure that we're all aligned on our understanding of the benefit cliff, the marginal tax rate, and its impact on families.
Great, thanks, Anna. Why don't we go to the next slide? Great, so I'm gonna start with just some common understanding of the terminology we use when we talk about these issues, because sometimes the words are thrown around there and we don't really all have a common understanding of them. So the first term I'm going to mention is the benefit cliff. Benefit cliff occurs when a family takes on new income, and because they take on new income, as a result, they lose a benefit. That could be SNAP, WIC, TANF, Medicaid, whatever it is. And the amount of income that they get is completely offset by the benefits that they lose. So I have here in this first bullet, let's say a worker gets another $100 through, let's say they get a raise, or they get a new job that pays more, or they take on more hours during the week, and they get another $100, which is great. But because their income has gone up, they now are ineligible for SNAP, and they lose $300 worth of SNAP benefits. So while they got more money from a job, they lost benefits, and so they actually have a net decrease in household income. The next term I'm going to mention is an effective marginal tax rate, or sometimes we just say a marginal tax rate. And a marginal tax rate is basically the proportion of the new earnings that a family would get through employment, the proportion of those new earnings that they actually don't get due to the taxes and lost program benefits. So an example here, a 50% marginal tax rate would be, let's say a worker gets another $100 through a raise or more hours and ends up losing $50 of their SNAP benefits as a result of that increased income. And so they've lost 50% of that new income. They've still got more income, but it's not as much as that total $100 increase. And so both of these are things that we talk about, terms we use to talk about the disincentives that are built into benefit schedule, income benefit schedules. Go ahead to the next slide. So I'm going to show you just what this actually looks like in a chart. Talithia is going to talk through the actual experience that families have in here. So I'm just going to kind of put out data and what we know from research, and then Talithia will fill this in so it's actually meaningful at the person or family level. But if you look at this chart, and if we look at, let's just look at the green line, we've got a family of one parent and one child. They get about $75 a month in a WIC benefit. But as soon as their monthly income hits $2,500, they lose that entire WIC benefit. And so from $2,499, if they make just one more dollar, they're losing their entire $75 WIC benefit. If we look at a family with one parent and two children, that cliff happens not at $2,500, but at $3,000. So this is what we mean when we're talking about a cliff. Let's go to the next slide. What's important to recognize is that marginal tax rates and cliffs are not universally the same. They don't affect every family equally. And there are many reasons for this, but one of the biggest reasons is the way each program has its own unique income eligibility level, its own unique phase outs for how benefits may decrease as income increases, or how they may cut off entirely as soon as the family crosses a certain income threshold. And because many families we know that get benefits, get multiple benefits, it's the interaction of all of these benefits that causes this really complicated marginal tax rate. And what's really interesting is, and I'll talk through this complicated chart in a second, is that the actual highest marginal tax rates, the people that experience the highest, are those that are between 100 and 200% poverty. So let's look at this chart to see if we can interpret what this means. Let's look at the red line. What this chart shows is it shows the median or average marginal tax rate experienced by families that have different poverty levels. So if we look at the red line, this is for all households in the US with children in them. So households that have between 100 and 124% poverty status. So their household income is between 100 and 124% of the poverty line. They, on average, experience a 51% marginal tax rate. And it stays really high up until about 200%. So for that family, that means if they earn $100, they're actually only keeping 49 new dollars. So if they get a raise in a week, they get $100 extra in the week, because of the benefits they're losing, they're actually only getting $49. And so the other thing that's interesting to see here is that households with children generally face higher marginal tax rates and are more likely to have a benefit cliff than households without children. And a big reason of that is many benefit programs target children, so things like WIC, SNAP, the Children's Health Insurance Program, several other benefits are specifically geared towards families with children. So that's great, but it also means these families face a bigger disincentive when taking on new income because they have a higher risk of losing more income from these benefits. And let's just do one last slide, and then I'll pass it over to Talithia. What I'm going to talk about here is just some general things that we've learned through the research about how people understand and respond to marginal tax rates. And it turns out that the structure of benefit programs, things like the actual benefit amount, the phase out, eligibility limits, and the stability that new income has or that new employment has, that's all influences how people respond to benefit loss. So I'll just walk through these bullets like in lightning speed so we can get to Talitha's more interesting discussion. We know that when a person is offered more income through work, again, either through more hours, higher pay, or a new job, if they're going to experience a benefit loss, of course, it means they're less likely to take that new income from job. If, on the other hand, the benefits that they are likely to lose have what we call automatic benefit recovery. So that's like, let's say you're getting SNAP, you're on SNAP, you're receiving SNAP, and you lose SNAP benefits because you just got a new job. If you lose that job and you're now eligible again for SNAP, if the state has set up an automatic benefit recovery, so you're automatically re-enrolled, then that means people are less worried about taking on those new earnings and are more likely to take that job. If they're still likely to lose a benefit, but the new job they get is more stable, like they feel very confident that they're not going to lose the new job or get those hours taken away, then they're less worried about the marginal tax rate or the benefit cliff. If the new earnings that they get will end up with more money overall, even if the risk, even if that marginal tax rate or benefit cliff is still the same, they're less worried. If the marginal tax rate itself is lower, even if net income is the same, they're less worried. What does all this mean? I'm just going to summarize this really quick and say, it turns out we have a lot policymakers that design these programs have leverage, have things that they can do to reduce the employment disincentives attached to marginal tax rates. Doesn't mean it's easy, but it can be done. And we're going to hear some of the things that are later on in the discussion in this panel that are being done. So I'm going to end there, and Talitha, I'm going to pass the torch to you.
Thank you so much, Robin. Hello again, my name is Talitha Edwards. I'm a lived expert consultant serving with the CICC in Tallahassee. I'm an organizer, urban planner, advocate, and coalition builder. I'm also the executive director of the Hand Up Project, founder and executive director of the Hand Up Project. The Hand Up Project is a statewide anti-poverty organization that assists and advocates on behalf of underserved communities. The economic mobility of many of the families in the communities I serve is impacted by the benefits cliffs. So I'm going to attempt to flesh out all of that data you heard from Robin and put some life and blood on a very complicated issue of benefits cliffs. And so families are typically experiencing cliffs receive public assistance from multiple assistance programs. Navigating these benefit systems can be cumbersome, and they require time, knowledge, and resources that many families simply do not have. Working multiple jobs, caring for children, or dealing with health issues can make it nearly impossible to manage the bureaucracy effectively. The lack of coordination between various assistance programs can be a full-time job in itself. Each program operates independently, often leading to more gaps and overlaps in support. To improve coordination, we need to think about streamlining the processes by simplifying the application and renewal process for benefits, which makes it easier for individuals to navigate multiple systems. Also, enhancing communication. Most systems don't talk, or communicate. So by fostering better communication and data sharing between agencies, this could ensure seamless support for those benefits from programs. Because we understand families are living, their lives are on fire, and they are intersecting and experiencing multiple cliffs at one time. So it's important, if we're thinking about enhancing these systems, that communication is also one of the first things that we do. And a conversation that I've actually been a part of for many years, but that has not materialized, is this idea of developing an integrated service model created by partnerships between local organizations offering a holistic support that truly wrap around the families and encourage upward mobility and economic independence. In Tallahassee, we have a few organizations that are attempting to do this and are really doing it well. ECHO and Capital Area Community Action Agency are great examples. They collaborate through initiatives like Getting Ahead and Staying Ahead, inspired by Ruby Bridges at her Out of Poverty work, to provide comprehensive assistance and empowering the individuals who are experiencing poverty. Through my work as an organizer and as the ED of the Hand Up Project, I've had the opportunity to build coalitions and working with many organizations. Through my partnership with Atlanta Fed, a few years ago, we worked together to create the CLIFS calculator. We can go to the next slide, please. The tool is designed to visualize how a change in earnings can lead to a reduction of loss in benefits. Due to the complexity of public assistance programs, workers often struggle to understand the timing and multitude of benefits lost. This uncertainty, coupled with economic insecurity, can prevent individuals from seeking and accepting opportunities for career advancement. You heard Robin say that, and people shouldn't have to decide to choose between a career advancement and making more money and losing a benefit, because if you're a parent and need to take care of your children, you are definitely going to choose the option that seems more stable and more secure. So continuing to have these conversations and using tools like this calculator, I think is, a really, really great thing. So additionally, individuals who do advance without understanding when their assistance will end may find themselves in situations where their standard of living doesn't improve or that it even declines. And so the Cliff suite of tools developed by the Federal Reserve Bank of Atlanta models the interaction of public benefits, taxes, and tax credits with career advancement. The Cliff suite currently includes three core tools: the Cliff Snapshot, the Dashboard, and the Cliff Planner. Each tool is tailored to meet clients in different stages of their career. And so I mentioned that Career Source Capital Area in my community is also using this CLIF calculator. They're an employment and educational advancement agency here in town. And so they work with employers alongside the clients to actually map out how and when, to avoid those particular cliffs. And so we understand that there are lots of hurdles. I talked about families' lives being on fire, or, being complicated by multiple social issues. And so we see here just a brief visual of the hurdles that families can actually be tending to at one time, right? Needing food assistance, medical assistance, transportation, having housing challenges, childcare needs, all of these particular hurdles. Increase the likelihood of economic instability, and avoiding cliffs allows for individuals to be more stable and moving. So lastly, if we'll go to the next slide, please. Lastly, we want to begin to think about, we want to begin to think and move beyond the cliff. And we want to do this by having better policy reform, right? By having better financial education planning for families, understanding that moving out of poverty is a process. We want to think about increasing the income threshold for those receiving benefits. I've had an experience with a client who was $2 over the limit and didn't qualify for a $600 food subsidy, right? And so these are things we have to think through. And so I talked about the support of community-based organizations and advocacy groups and the way that we can wrap around these families, as well as innovative ways of employers for getting involved to create varied incentive pays, right? There's no restrictions from an employer deciding that they're going to give incentive or payment increase in varying ways. They have that option. I just don't think we've explored incentive pay in varying ways enough. But also by adopting a more integrated and coordinated support, we can create supports. We can create systems that support upward mobility and economic independence for families experiencing poverty. And so this was a quick 5 minute that I had, but I wanted to really help you understand how families are navigating, what organization best practices, in my opinion, from where I am locally in my own context, and ways for us to think beyond the cliff. And so I will now pass it on to the next person. Thank you.
Hello, everyone. Thank you so much for having me here. I'm Christina, and we'll be walking you through a little bit about what 2Gen is in Connecticut, the implementation of the CLIP tool that Salitha lifted up, and also just very briefly on some policy that we've been working on. And so 2Gen, on the next slide, 2Gen puts families on a path to economic stability. In short, that's what the 2-generational initiative is here in Connecticut. In 2015, we were the first, Connecticut became the first state in the nation to pass legislation codifying a 2Gen initiative in statute. And we create opportunities for and address the needs of 2 generations through education, training, and social supports. A lot of that was lifted up here throughout the panel discussions. But I think most importantly is that the 2Gen initiative whole family approach creates opportunities to, again, address the needs for 2 generations. If you take nothing away from my short 5 minutes, make sure you take that away. It addresses or it helps parents get the education, training, social supports they need to succeed. And it allows parents the ability to pass on that economic security. So I said that twice just to kind of nail it down so that you got it and you can leave with it. 2Gen avoids the traditional siloed approach to confronting economic instability. It relies on collaboration across agencies and sectors, data sharing and leveraging existing resources to drive down cost and promote economic success. But most here, I think, is another important key factor is that we empower parents as civic leaders and partners in our work. We have parents sitting on our 2Gen advisory board. We have parents who are lifting up this work, who are changing policy through their lived experiences. Salitha lifted that up a little bit on her experiences, and we capitalize on our families, and we really listen. We really listen to all of the, concerns that they have and the things that they want to uplift that are important to them so that they can change policy and program strategies. And so on the next slide, we do this in partnership with our parents and other organizations and nonprofits. But I know that Salitha also mentions in her presentation that the Federal Reserve Bank of Atlanta created this CLIP tool. And this CLIP tool that we're using stands for Career Ladder Identifier and Financial Forecaster. And for us here in Connecticut, which it will be developed for all other folks for free. And if I'm not mistaken, the Federal Reserve Bank of Atlanta would love to hear from other states if you're interested in using this resource. But Connecticut is very thankful for this tool to assist our families. And Salitha, we're very thankful for you for being able to be a part of that process. So thank you. And so the CLIP tool has 3 different tools, as Salitha mentioned: snapshot, dashboard, and planner. And so here before you, you see the projected income along selected career path. The planner is the tool is a very detailed tool. It's tailored to meet the worker's needs in different career stages. The Federal Reserve Bank of Atlanta staff keeps each tool up to date with the relevant local information and policy changes on wages and eligibility requirements. So you don't have to do any of that legwork. You don't need to remind the Federal Reserve Bank to do that. They do that automatically, which makes it so much easier for career coaches, case managers, navigators, eligibility workers to use the tool in real time. And so the Cliff Planner is the most detailed tool, and it helps you to make a plan with clients for the details of changing careers like education and training and loss of government assistance. Counselors can work with clients to build a customized education plan, career plan, and budget. And the Cliff Planner can help those who say, for example, I want a career that helps me reach economic stability, but I also need assistance with my education plan and my budget. And so case managers can use the Cliff Planner to help clients identify the training programs that will increase their earnings and improve the pathway to self-sufficiency. Isn't that amazing? And so we are also executing this Cliff tool with our parents. So we've trained our parents in this Cliff tool, and we have pushed out, and so parents are now working with other parents, and so that is something that's truly amazing. And so I'm going to now quickly just run through our rollout plan. We've been doing this, training other parents. We've been training and working with families and organizations. And so I'll slide it over to Sarah to talk a little bit about our policy.
And Sarah, this is Anna, the facilitator. We need to wrap up in about a minute, so I'm just going to ask you to chime in quickly. Thanks.
Oh, 2 slides up, please, folks. So just to say, here we are. So just to say that in order to address benefit cliffs, the Connecticut has done an incredible job of over about 5 or 6 years thinking about different policies. They range from most recently, taking the TANF time limits and changing those, increasing asset limits, repealing a family cap a couple years ago, thinking about how to change Medicaid. They've added an entire Medicaid program. So there's a range of tools. Benefit cliffs don't have to be solved from a policy perspective in just 1 year. It can take multiple years. And then ultimately now we are looking at talking with the federal government, because as someone said before, it is a federal state interplay that really requires us to work together to be able to solve the cliff effects so that families have economic mobility. And that is where I will end it for you, Anna.
Thank you so much. And thank you so much to all the panelists. I'm sorry we don't have time for Q&A, but I think if you just had 1 or 2 takeaways, it would really be to hear how there are so many innovative, promising solutions to this very complex problem. I think Talicia raised up a lot of those in her last slide as well. And so we're really grateful to the panelists and the collaboration and all working together on solving this very tricky problem around the experience of receiving benefits. So I will pass it over to Jennifer to close this up.
Great. Thank you, Anna. Thank you again to all our presenters and moderators for being a part of this knowledge exchange, and to each and every one of you participating today. Thank you for taking some time out of a busy Monday to engage in this work. I also just want to acknowledge and really express all of our sympathy for the loss of Jillian's daughter. Jillian, I think you know we're so grateful to you for sharing this, for showing us just how consequential these issues are in our lives, and really for your work to improve access so that other children may benefit. So thank you very much. We can go on to the next slide. So I think, as we previously noted, we have several resources and materials here from our presenters and selected federal resources for references. We are going to post and share the slides and this recording. We learned just so much today. I think, as many people said, one of the most important things we learned is that there are solutions and things we can do to make things better in many ways. So I look forward to discussing that with my fellow council members. Thank you again for being part of our first event and for all that you do to grapple with these issues. Have a wonderful week. Thank you.